Researchers in London, Ontario are treating COVID-19 with a modified dialysis device. Now, this is a controlled trial, and it's the first of its kind in the world. Dr. Chris McIntyre is leading that trial, and he joins us this morning. Thanks for being with us.
Good morning. Hi.
Hi, we know dialysis is used for patients with kidney failure by filtering their blood, but where did the idea come from to explore its application for COVID-19?
So we were watching around the world as this disease unfolded, and we got a particularly close view as some of our research team are actually Italian and had returned back to North Italy to help with the efforts there. And it was becoming very clear from their reports that although the first part of the disease is the terrible pneumonia driving the demand for ventilators, the second part of the disease for people who are very ill in ICU is actually partly to do with inflammation and how the immune system that's trying to help decides to get overactive and then starts to do damage. So we started casting around for technologies that already existed. And there was already some information that we could take the white cells, the parts of the body that produce and fight infection and inflammation, and reprogram them to become anti-inflammatory. The problem
That
was
is fascinating. I was going to say, how does that work? How does the machine reprogram your blood cells to fight inflammation?
So we can take the white blood cells outside of the body using the dialysis machine to move the blood. And then we can stick them on the outside of a filter. And then because they're stuck there, we can then chemically treat them to alter them from an active to an inactive type. And when they get to that inactive type, they fall off the filter and return to the patient. And hopefully at that point, home in on the various organs that are full of inflammation and try and control that.
This is fascinating. The trial right now involves 40 critically ill patients. So some of them are receiving this new treatment. Some are getting the standard care for the virus. What results have you seen?
Well, it's early days yet, and the study is based on measuring in the blood levels of inflammation and looking to see if blood pressure and the need for blood pressure supporting medications changes. And so far, the responses have been very positive, but obviously it's very early days and we're still carrying on with work.
This is a fascinating trial, and I know that it is being watched worldwide because it is the first of its kind in the world. If it's successful, what will it mean?
It would mean that using equipment and consumables, the plastic parts that are actually available pretty much in every ICU already around the world, we would be able to try and have an active treatment, which would be easy to introduce and also not particularly expensive.
If it is successful in treating COVID-19, could it be used for other diseases?
Yeah, we think it could also be applied to anything that involves a great deal of inflammation, and that's really characteristic of just sepsis, people who get bacterial infections and get very ill in intensive care units, and that's a very common reason to come to the intensive care.
It is a fascinating trial that you're putting on, first of its kind in the world. Thank you, Dr. McIntyre, for joining us this morning. We will be watching closely the results along with your colleagues. Thank you.
Pleasure. Many thanks. Bye-bye.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.